Officials from states reporting surges in new coronavirus cases are admitting it was a mistake to open early and that this is the reason they're now dealing with the surges. Texas is going through what New York was going through in April as the daily new cases throughout the United States reached a record high for the 27th straight day. We don't have room to experiment, we don't have room for incrementalism when we're seeing those kinds of numbers, said Judge Lina Hidalgo, D. Harris County's top elected official. The Texas county includes the Houston metro area. Nor should we wait for all the hospital beds to fill and all these people to die before we take action. At least 121 University of Washington students have tested positive for COVID-19, according to the school. 112 of those affected live in fraternity houses near the campus in Seattle. The medical school at the university has established a pop-up testing site near the fraternities. Montana, Delaware, and Alaska are experiencing the largest percentage changes out of 13 states that are reporting new highs in their 7-day case averages. West Virginia set a record number of daily cases with 130. South Carolina, Texas, Arizona, Nevada, and California are reporting a record number of hospitalizations. While the country's 7-day average of new deaths fell from 562 to 485, health experts say that number will be going up with the number of new infections. It's greatly affecting local leaders as they try to curb the surge of infections. They report conflicts between following the pandemic's guidelines and the guidelines from governors and the White House. After Texas reported a single-day record for new cases, Austin Mayor Steve Adler, D., appeared on CNN's State of the Union and expressed concern of not enough hospital beds or medical staff to take care of the surge in cases. If we don't change this trajectory, then I am within 2 weeks of having our hospitals overrun, said Adler. He also mentioned that the ICUs in the city could be reaching capacity within 10 days. While not being sure if a statewide shelter-in-place order is necessary, he wants the authority to impose one locally. The same concerns are shared by Houston Mayor Sylvester Turner, D. The Houston hospitals are facing staffing shortages, and the need for ICU beds is increasing rapidly, he told CBS News' Face the Nation. In fact, if we don't get our hands around this virus quickly, in about 2 weeks, our hospital system could be in serious trouble, he continued. Demand for testing is higher than the city's capacity as well, and the positivity rate has soared from 10% to 25% in just 1 month. Hidalgo said in an interview on ABC News this week that she no longer has the authority to issue stay-at-home orders in her county as she did earlier in the pandemic. Governor Greg Abbott, R., went with a more aggressive reopening plan in the spring. Now she is confined to making recommendations, which aren't as effective. As long as we're doing as little as possible and hoping for the best, we're always going to be chasing this thing, we're always going to be behind, and the virus will always outrun us, added Hidalgo. And so what we need right now is to do what works, which is a stay-home order. Florida's new cases passed the 10,000 mark 3 times last week, with one of those days being 11,458. This puts the state with a total number of cases over 200,000, something only 2 other states, New York and California, have achieved. Miami Mayor Francis X. Suarez, R., told ABC News it was clear that the growth is exponential at this point. He added, "There's no doubt that when we reopened, people started socializing as if the virus didn't exist. It's extremely worrisome." Phoenix Mayor Kate Gallego, D., blames Arizona's decision to reopen completely before the virus was under control for the surge in cases there. She also mentioned young people ignoring guidelines and believes that probably played a part as well. She requested community-based testing in her area after people reported they had to wait in line for 6 hours at some testing sites. Federal officials dismissed her requests. "We were told they're moving away from that," she said, which feels like they are declaring victory while we're still in crisis mode. New Jersey Governor Phil Murphy, D., believes there should be a national requirement for wearing masks. "We went through hell. We cannot afford to go through hell again," he said on NBC News' Meet the Press. We need a national strategy, I think, right now, and masking has got to be at the core of that. These comments were all after Donald Trump said on Saturday that his administration had made a lot of progress in fighting the coronavirus pandemic. He added that the US has learned how to put out the flame of the virus. He continues to suggest testing has inflated new case numbers. Public health experts dispute that increased testing is solely behind the surge in cases. When the virus is under control, testing doesn't uncover more cases, said former FDA Commissioner under Trump, Scott Gottlieb. It's a tool for keeping the epidemic at bay. He's doubtful the country has the ability to slow the pandemic, noting that the wave of the virus will probably persist through the rest of 2020. We're not going to really be able to crush this virus at this point because there's just so much infection around, he said on Face the Nation. We really don't seem to have the political will to do it.